Residential options. It's scary to think about, but have you prepared alternative plans in the event that something tragic happens to you, the caregiver? What about if your child's behaviors become too severe for you to handle at home? Even if you plan to keep your child at home with you after they graduate high school, it is important to explore and evaluate the options available to you as far as residential options go. Let's check out the 3 main options that are available for your child with intellectual and developmental disabilities: state-supported living center, intermediate care facilities, and community-based services, programs, and facilities. State-supported living centers. State-supported living centers provide 24-hour residential services in a structured environment for people with intellectual disabilities. Residents live in a safe, campus-based setting where they receive individualized on-site behavioral treatment and healthcare, including primary and specialty medical care, psychiatry, nursing, and dental. Additional on-campus services include clinical therapies provided by full-time professional staff, 24/7 video surveillance of living, dining, and day program areas, skills training, day habilitation and vocational employment services, customized adaptive aids, including seating and positioning devices, a wide variety of highly specialized, quality-controlled diets, and religious services for different faiths. SSLCs also provide services such as transportation and staff so residents may maintain connections with their families and natural support systems, as well as planned activities such as shopping, dining out, going to movies, and other recreational and leisure activities with their local communities. Our local state-supported living center is the Lufkin State Supported Living Center, and it houses female and male residents. The provider name is the Lufkin State School, and the contact phone number is 409-853-8350. Community-based intermediate care facilities. Community-based intermediate care facilities for individuals with an intellectual disability, we call these group homes. Community-based ICFs, IID, provide 24-hour residential services for people with intellectual disabilities or related conditions. Residents have access to comprehensive and individualized services and supports in their local communities, including primary and specialty medical care, behavioral treatment, clinical therapies, nursing, and dental treatment. Residents have access to comprehensive and individualized services and supports in their local communities, including skills training, vocational programs and habilitation services, adaptive aids, specialized diets, and planned activities such as shopping, dining out, going to the movies, and other recreational and leisure activities in their local community. There is not a waiting list for ICF IID services, and immediate placement may be available. Eligibility. The individual must have a diagnosis of mental retardation, be in need of and able to benefit from the active treatment provided in the 24-hour supervised setting, and meet the Medicaid criteria and the level of care determination criteria. Group homes in Lufkin. First facility name is 510 Jefferson, and it's male residents only. The provider name is St. Giles. Local authority is the Burke Center. And there's the contact number, 800-299-5161. Another facility name is the Cunningham House. That's for female residents only. The provider name is the Burke Center. The local authority is the Burke Center. And the contact is Stephanie Chun at 936-634-2422. Another group home in Lufkin is the Howard House. It's male residents only. Provider name is St. Giles Living Center. Local authority is the Burke Center. And you can contact the caregiver at 800-299-5161. 5161. Another group home in Lufkin, Hudson Community Home. It's male residents only. The provider name is Educare Community Living Limited Partner. Local authority is Burke Center. Contact Patricia King at 936-639-4941. Another group home in Lufkin, the Marcus House. It's male residents only. Provider name is St. Giles Living Center. Local authority, Burke Center. And contact number is 800-299-5161. Another group home in Lufkin, Southwood Community Home. It's male residents only. The provider name is Educare Community Living Limited Partner. Local authority is the Burke Center. Contact information is Patricia King, 936-639-4941. And continuing on, another group home in Lufkin is the Stetcher Community Home. It's male residents only. Provider name is the Educare Community Living Partner. Local authority is the Burke Center. Contact information is Patricia King, 936-639-4941. Westside Community Home, female residents only. The provider name is Educare Community Living Limited Partner. Local authority is the Burke Center. Contact Patricia King at 936-639-4941. White Dove Community Home is female residents only. Provider name is Educare Community Living Limited Partner. Local authority is the Burke Center, and the contact is Patricia King at 936-639-4941. HCS programs. HCS programs means home and community-based services programs, group home and host home companion care. The HCS program can provide 24-hour residential assistance for people with intellectual disabilities or related conditions who live in a group home where no more than 4 people are receiving services, and a host home or companion care setting. So what is HCS? HCS is a Medicaid waiver program that supplies services and supports to Texans with an intellectual disability or a related condition so they can live in the community. HCS services are intended to supplement rather than replace services received from other programs such as Texas Health Steps or from natural supports, including families, neighbors, or community organizations. Who can get HCS? HCS may be available to any Texas resident not living in an institutional setting who has an IQ of 69 or below, or has been approved for a related condition with an IQ of 75 or below, has mild to severe deficits in adaptive behavior, is eligible for Medicaid benefits, is not enrolled in any other Medicaid waiver program. Who provides HCS services? The Texas Health and Human Service Commission, HHSC, contracts with public and private entities to provide HCS services. When enrolling in the HCS program, applicants choose their provider from a list of available providers in the area. Individuals are able to change providers at any time, even if they move to another area of Texas. Individuals can also choose to hire and train their own service providers under the consumer-directed services option. What services can HCS provide? Residential services, group homes, host home and companion care, respite services, day habilitation, employment services, nursing services, dental services, behavioral support, and supported home living and transportation. Continuing, HCS services provide social work, occupational therapy, physical therapy, speech therapy, dietary services, audiology services, cognitive rehabilitation services, accessible minor home modifications, adaptive aids, transition services, assistance services. Those interested in receiving HCS services are placed on an interest list by contacting their Local Intellectual and Developmental Disability Authority, known as LIDA. The Burke Center is that local authority for Lufkin area. An offer of the HCS program depends on an individual need, one's date of placement on the interest list, and the availability of funding for the program. Once HHSC approves an offer for HCS, the Burke Center will assist with the application process as well as coordinate the enrollment and ongoing services. Public HCS entities, Burke Center, St. Giles Living Center, Incorporated, and Innovative Homes of Deep East Texas, Incorporated. Private pay HCS entities, the Monarch School in Houston, Texas. The city and state is Houston, Texas. Lifestyle is transitional and collegiate. Primary residents are autistic adults, individuals with IDD, or neurodiverse. Level of support is 24/7 support, moderate needs support, semi-independent, and drop-in support. And you can visit their website at monarchschool.org. Another private pay HCS option is Live Oak Community. The city is San Marcos, Texas. Lifestyle is agriculture and ranching community, live, work, play community, suburban, transitional, collegiate. Primary residents are autistic adults and individuals with IDD. Level of support, moderate support needs, semi-independent, and drop-in support. You can visit their website at liveoakliving.com. Another private pay HCS entity is Southwinds Fields, and the city is in San Antonio, Texas. Lifestyle is faith-based, live, work, play community, suburban, and transit-oriented and urban. Primary residents, autistic adults, and individuals with IDD or neurodiverse. Level of support, moderate support needs, semi-independent, and drop-in support. You can visit their website at southwindfields.com. And that is it for residential options.